If you should require assistance during the call, please press star then 0. I would now like to turn the conference over to our host, Supervisor Kathryn Barger. Please go ahead.
Thank you. Good afternoon, and thank you for joining us today. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Before I invite Dr. Ferrer up to give her update, I'd like to share a creative way our Department of Parks and Recreation is supporting your health and well-being while you're safer at home. This Wednesday, Parks is launching the Virtual Recreation Center Parks from Home program, which can be accessed from your computer or mobile device. Park staff is offering fitness and instructional classes, including exercise, health, and sporting skills development. Many kids have missed out on their baseball and softball leagues, but with this virtual recreation center, you can watch tutorials that can hone in their athletic skills at home. Additionally, Parks at Home will provide live videos of your favorite nature spots. You can explore scenic trails and enjoy plants, flowers, and animals at our beautiful botanic gardens. Please visit parks.lacounty.gov, again, parks.lacounty.gov, and follow them on social media at LA County Parks to access these incredible resources. In a moment, Dr. Barbara Ferrer, Director of Public Health, will provide updated case counts and discuss the results of the county's seroprevalence study. Before I invite her up, I want to take a moment to discuss testing. Expanding testing and contact tracing are fundamental in our efforts to address COVID-19. I am committed to doing everything possible to increase the availability of these vital efforts. My colleagues and our partners at the local, state, and federal levels will leave no stone unturned. We are dedicated to protecting the health of our residents and supporting the return of our communities and our businesses. Every effort is underway to help us achieve these goals. With that, I would like to introduce Dr. Barbara Ferrer to give the updated numbers. Thank you.
Thank you so much, Supervisor Barger, and to the entire Board of Supervisors. I'm thrilled that you've somehow managed for months now to facilitate a coordinated and collaborative effort across the entire county. And I greatly appreciate everything you're doing for all of us. I want to update you on our current status today. I'm sad to report that we've lost an additional 17 people to COVID-19. 13 of the people who passed away were over the age of 65, and 11 of the folks who were over the age of 65 and passed away had underlying health conditions. 2 people are between the ages of 41 and 65, and one of these people also had underlying health conditions. And one person was younger, between the ages of 18 and 40, and they had no known underlying health conditions. We don't have information on one case as it's being reported by the City of Long Beach. This does bring the total number of deaths in LA County to 617 people who have passed away. 89% of the people who have died from COVID-19 had underlying health conditions, and this reminds us that we need to do everything possible so that it's possible for those people with underlying health conditions to stay safe at home. For the 544 deaths where race and ethnicity has been identified, 16% of those who passed away were African American, 17% were Asian, 36% were Latinx, 28% were white, and 3 people who died were identified with another race or ethnicity. As we report the number of people who have died from COVID-19 each day, we know that these numbers represent lives lost and families and friends who are experiencing profound grief. To all of you, our thoughts and prayers remain with you in the days ahead. Over the weekend, we received a large backlog of test results from one lab, and these were results that were conducted for tests between the April 7th and April 14th. This is a tremendous lag in data reporting to the Department of Public Health, and we're working hard to make sure that we don't have backlogs moving forward. But as a result of this, we're reporting an additional 1,491 positive cases today, though this does not represent the number of new cases in a single day. 1,198 of these positive cases are from the backlog, and the additional 293 are from our daily reported cases. This demonstrates that we're both having an increase in the number of cases and that in expanding testing, we have to make sure that our labs are easily able to report their results to the Department of Public Health. There are now a total of 13,816 cases in LA County. These cases include 457 cases that were reported by our partners in the City of Long Beach and 215 cases reported by the City of Pasadena, both which have independent city health departments. We are also reporting 47 confirmed cases among people experiencing homelessness. The majority of the people experiencing homelessness who tested positive for COVID-19 are amongst those that are unsheltered. There are 12 people experiencing homelessness who were sheltered, and now they're appropriately isolated and their close contacts are quarantined. We are conducting today investigations at 8 different shelters and identifying staff and guests that need testing, isolation, and quarantine. There are 3,465 people who have been positive for COVID-19 and at some point were hospitalized. This remains about 25% of all of our positive cases. There are 1,709 people who are currently hospitalized. 30% of these people are in the ICU, and 17% are on ventilators. We're also currently investigating 265 institutional settings with at least one confirmed case of COVID-19. This is 37 additional investigations since last Friday. And among the sites we're investigating are nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total number of confirmed cases in these institutional settings is 2,733, and this includes both staff and residents. 1,580 cases are among residents, and 1,153 cases are among staff. And I'm sad to report that 241 residents have died from COVID-19 who were residing in institutional settings. The vast majority were residing in our skilled nursing homes. And this now represents 39% of all of our deaths. This week, we are planning to release a dashboard with information by site that includes the number of positive and suspect cases among residents and staff and the number of deaths by each institutional facility where there's an ongoing investigation. We've also requested assistance from the Centers for Disease Control and the state to help address the need for increased technical assistance at all the sites around infection control and the need for staffing support to address the high rates of cases amongst employees. We're working hard with nursing home providers to increase the number of sites that can serve COVID-19 positive patients that need to reside at the skilled nursing facilities and the intermediate care facilities. And we're going to continue to work hard, again, federal partners, state partners, and local partners, to make sure that our nursing homes in particular are as safe as they possibly can be during this pandemic. I'm also reporting 78 confirmed cases that have occurred at some point over the last 2 months in our jail facilities. This is 26 people who are incarcerated and 52 staff. The Sheriff's Office is currently reporting that there are 19 inmates currently incarcerated that have tested positive. 7 inmates have recovered. 64 people who are incarcerated are in isolation, and 1,724 people incarcerated are quarantined. There are also 59 cases in the state prison, and that's among 47 people who are incarcerated and 12 staff. And there are 48 cases in the federal prison facilities. That's among 46 inmates and 2 staff. We are reporting today the second death of a person who was an inmate at a federal prison facility. There are 10 cases now reported amongst staff at the juvenile facilities, but they're all among staff. We do post a list of the facilities with confirmed cases on our website once those facilities have had an opportunity to notify their staff, residents, and families. And as a reminder, you can see an updated report every day on all LA County cases on the Department of Public Health's website at publichealth.lacounty.gov. The LA County Sheriff Department is reporting 51 positive cases among their staff. They have 307 staff that are quarantined and 543 staff that have been able to return to work. The LA County Fire Department is reporting 17 positive cases among staff. They have 9 staff that are quarantined at home, 3 who are in isolation and sick at home, and 14 who have returned to work. I want to thank Sheriff Villanueva and Chief Osby for continuing to provide us with this data. There are now over 80,000 people who have been tested and had results reported to the LA County Department of Public Health, and 13% of people who were tested are positive. Today, I also want to share with you some preliminary findings from our community prevalence study. This was a serology study that I spoke with you all about last week. We are doing this study in partnership with the University of Southern California and the LRW group. And I want to thank Dr. Sood from the University of Southern California's Price School of Public Policy for being here today. And we look forward to hearing from him in a moment about this study. In this serology study, we tested 863 LA County adults between April 10th and April 14th using serology testing. This is the testing that shows whether a person has ever been positive for COVID-19 and developed antibodies to the virus. And this gives us a better understanding of how much of our population has, at some point in time, been positive, been infected with the COVID-19 virus, regardless of whether they were ever tested or they even ever had any symptoms. And overall, the study estimates a prevalence of COVID-19 antibodies in LA County to be 4.1%, with a range that could be as low as 2.8% and as high as 5.6% when you factor in the reliability of the tests that we were using to measure the antibodies. This translates to an estimated 221,000 adults at the low end to 442,000 adults at the high end who may have been infected at some point with COVID-19. So although I report every day that we have thousands and thousands of people that have tested positive, the serology testing lets us know that we have hundreds of thousands of people that have already developed antibodies to the virus because at some point in time over the last couple of months, they have in fact been infected with COVID-19. And it does suggest that the number of total people in the county with a past or current infection is 28 to 55 times higher than the number of reported positive cases. It does, for me, reinforce the need for everyone to continue to stay home, to observe all of our physical distancing requirements, because there are many, many people throughout the county who are positive for COVID-19 who may not be showing any symptoms. So I've talked before about the need to observe universal precautions. This means that given the high rate of people that may have been infected at some point with COVID-19, we need to assume that at any point in time we could be infected and that all of the other people we come in contact with could also be infected. And that means keeping our distance, using our cloth face coverings where we're in close contact with people, and staying home if you're sick so that you don't expose anybody else to any of your germs. Although the sample size was relatively small, we can share some early estimates about who was most likely to have been infected. Men were more likely than women to have been infected. The estimated prevalence was 6% amongst men and 2% amongst women. 7% of African Americans, 6% of white residents, 4.2% of Asians, and 2.5% of people who were Latinx who were tested were positive for COVID-19. 2.4% of people who were between the ages of 18 to 34 who were tested, 5.6% of people who were between the ages of 35 and 54 who were tested, and 4.3% of those who were tested who were 55 and older were also positive for COVID-19 from our study. Again, this data is preliminary, and we'll continue to sample residents across the county for the next few months so that we can better understand the prevalence of COVID-19 amongst groups within LA County. This information does help us figure out how COVID-19 may be showing up in our communities. But I do want to issue a reminder that being positive for COVID-19 antibodies does not mean that a person is immune or that a person is not able to be reinfected. More research is really needed to understand what protection people have who may have already been infected with COVID-19. And before I close, I just want to issue a reminder that for those of you who are experiencing violence or the threat of violence in your home, help is available. If you're a friend or family member of someone who's feeling unsafe in their home, you can also reach out for services. LA County's domestic violence services remain available, and shelters are open and accepting intakes. Law enforcement will continue to respond to any domestic violence 911 calls, and emergency protective orders are being issued. Nonprofit legal services remain available. Please, if you need help, call the domestic violence hotline at 1-800-978-3600. I'll repeat that number, 1-800-978-3600. And I want to thank everybody for doing all that you can do to prevent the spread of COVID-19. I also want to remind folks that if you're having chest pains or other symptoms that may be an indication that you need to go to the emergency room, our emergency rooms are open and they're safe. And there's capacity for you to get treatment. So please don't delay seeking care if you're ill and need to be seen in an emergency room. As a reminder, the weather is going to get nice, and we're thrilled to have our Southern California sunshine back. But I do want to remind everyone that safer at home order is still in effect. Public gatherings of any kind, including outdoors, are prohibited. You can still enjoy the outdoors with your walks and your runs. You can sit in your yards. You can sit by yourself or with your family in our parks. But you must do this without congregating with other people. I appreciate all that you're doing to slow the spread of COVID-19. The efforts that we're making together as a community are working, and I thank you from the bottom of my heart. And now it's my pleasure to introduce Dr. Sood, a professor and vice dean for research and faculty affairs at the USC Price School of Public Policy, and he's a founding member of the USC Schaefer Center, and he's going to be able to speak a bit more on the serology study. Thank you, Dr. Sood.
Thank you, Dr. Ferrer and Supervisor Barger, for having me here. Before I talk about the study, I want to acknowledge all the people and the organizations that contributed to the study. So this is a true public-private partnership between USC, LA County Public Health, and the LA City Mayor's Office. This study would not be possible without the leadership and vision of Dr. Ferrer and Dr. Paul Simon, who is the Chief Science Officer for LA County Public Health. I also want to acknowledge President Carol Fold, who provided funding for the study, as well as the Jadel Foundation, the USC Schwarzenegger Institute, USC Luss Center, and many individual donors who contributed to this public health study. We had a lot of volunteers for the study, especially Keck medical students, and I want to thank them for their time that they devoted to the study. So now, what did we find? There were two important findings. The first finding was that, as Dr. Ferrer mentioned, when we tested about 863 individuals who were representative of LA County, about 4.1% of them tested positive. And now we know the population of Los Angeles is about, of adults in Los Angeles County is about 8 million. So if you take that population of 8 million and apply the 4.1%, what we get is about 320,000 adults in Los Angeles County who have had a COVID infection before April 9th, before we started doing the testing. You compare this to the confirmed cases of COVID-19 in Los Angeles County, what we get is that the number of true infections based on the study is 40 times larger than the number of confirmed cases. So this highlights the importance of using serology testing to continue to monitor this disease. Serology testing can provide important information on the true extent of the infection in our communities. The implications of these findings are twofold. One, it says that mortality rates estimated based on confirmed cases are going to be much higher than mortality rates estimated based on the number of infections or the estimated number of infections. So we could say maybe the good news is that the fatality rate is slightly or is lower than what we thought it would be. But the fatality rate is not the only number we should focus on. That is not the only number that determines the burden of disease. What the findings show is that only 4% of our population has been infected, which means we are very early in the epidemic, and many more people in LA County could potentially be infected. And as those number of infections rise, so will the number of deaths, the number of hospitalizations, and the number of ICU admissions. So the study says we need to continue monitoring this epidemic through serology testing and other means. We need to take the data we are getting and update and recalibrate our models of what would happen in the future as more people get infected, and then ultimately use these better models, the more accurate data, to guide public policy decisions about how to combat this epidemic. Thank you. Grace, we are ready for questions.
Thank you. Ladies and gentlemen, if you wish to ask a question, please press 1 and then 0 on your telephone keypad. You may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, if you have a question, please press 1 and then 0 at this time. And first we'll go to the line of Steve Gregory with KFI News. Please go ahead.
Go ahead.
Last week you spoke about sort of protocols to ease back into normalcy, and you know, we might see trails that go one way and restaurants that have capacity, things like that. When can we expect to continue or resume in-person press conferences, even in a limited capacity? The sort of restrictive accountability starting to get a little frustrating. Secondly, in terms of the nursing homes and skilled nursing facilities, you seem to be really focusing a lot of effort now in the last week on nursing homes. Were nursing homes a bit of a red flag for you back at the beginning of all of this when, like, Kirkland, Washington was having issues? And what steps were being taken, if you can give me a quick timeline, on how nursing homes were being looked at back then? Thank you.
Okay, I'm going to have Dr. Farrar answer both those questions. Go ahead, Dr. Farrar. Well, on the first one, I can tell you that Supervisor Solis and I are going to be introducing something, hopefully this week, that is going to discuss how we're going to go about looking forward in terms of reopening certain businesses, but we're working with Dr. Farrar on that as it relates to the timing. Dr. Farrar?
Yeah, thanks. I appreciate the question on sort of press conferences. I Also want to thank everybody for their patience. This is awkward, I know, and some of you have not been able to easily get your questions answered. So I appreciate that you've made sure that you've sent them to various people who are here so that we can answer them afterwards. And I don't have a timeline for when we get back to sort of press conferences as they were. I mean, as I noted earlier, I mean, we continue to need to do as much social distancing as possible. So I think we have to sort of balance sort of the reopening with where is it possible for us to still maintain a lot of distance as we think about relaxing some of the restrictions. But I do want to go to the nursing home question. So we started in February actually sending out technical assistance teams to every single nursing home, every single interim care facility, and every single shelter and interim housing facility to actually help them take a look at their infection control protocols and do some planning about how they would manage an outbreak situation at each facility. And really there were assessments done as to what each facility was capable of doing and what might be some of the barriers for being able to particularly provide isolation and quarantine on site. And I want to thank the many team members that spent weeks completing those assessments and working with each facility. Nonetheless, even though we strengthened infection control protocols and reinforced, particularly at the nursing homes, the need for there to be capacity for isolation and quarantine, as we've seen across the country, nursing homes it's very difficult in a nursing home to contain the outbreaks easily. And part of that is the nature of the relationships that employees have to those nursing homes. Many employees work in multiple sites, and so once those employees are infected, and now we know that they can be infected without symptoms, which we didn't know back in February, which was really do temperature checks of employees and symptom checks before they come in, but it turns out people can be asymptomatic and still shedding virus. So as we learned, many employees work in multiple settings, and that's because they're often not paid well and they need to have more than one job. So they're doing that to really be able to manage to survive, but it does make it hard as employees travel between the different nursing homes for us to have easily been able to contain the outbreaks from the very beginning. We are working really hard now, but we've actually been working hard from day one when we started seeing cases. And I will note, as I noted in the past, although we do have more nursing homes that have more than 5 or 6 people in that nursing home, residents who are infected, we still have many, many nursing homes that only have 1 or 2 people that are infected. And in fact, our teams are working hard to keep those numbers as low as possible. And as I noted earlier, we do have a strategy to try to make sure that we're able to find places and spaces for people who are residing in nursing homes and are COVID-19 positive but don't need to be in a hospital to have a place where it's safe for them to do their recovery. I'll take the next question now.
Thank you. And next we'll go to the line of Melanie Mason with Los Angeles Times. Please go ahead.
Hi, this is a question with regards to the sample of adults that participated in this serology study. The Santa Clara study that came out on Friday got a little bit of criticism for its the way it was compiled because it was sort of a self-selected group of people that were recruited via social media, and that led to some concerns there may be some self-selection bias in the sample. My understanding is that the adults that participated in the LA County study were recruited via marketing firms, but can you talk a little bit more about how we should understand this sample, and is it true to say that this is a randomized sample, which I know is the gold standard for these type of community surveillance studies?
Sure. So we worked with a market research firm called the LRW Group, and they have a database of email addresses as well as phone numbers of people residing in Los Angeles County. And we picked a random number of emails or phone numbers to contact for people to help to participate in this study. So in that sense, it was a random sample, that it was a random sample picked from from this database maintained by the market research firm LRW. And then we set quotas based on the demographic distribution of LA County. So we wanted our sample to try to mimic LA County in terms of its age distribution, gender distribution, race, ethnicity. So that was the process we followed to try to make the sample representative.
We'll go ahead to the next question.
Thank you. Next, we'll go to the line of Patrick Healy with NBC4. Please go ahead.
Hi, thank you very much. Also interested in the serology study. First of all, could you tell us what was the rate of false positives and false negatives that you established for the study? And then could you comment on some of the results, the startling results that men are 3 times more likely than women to have been positive? And again, that Latinx shows such a disproportionately low percentage. Thank you.
Thank you for that question. So we have 2 sets of data on the sensitivity and the specificity of the test we used. One comes from the manufacturer of the marketing, the firm from which we got the test kits, and this is the data they reported to the FDA. And the other comes from an assessment done at a lab at Stanford where we took the test kits and we tested them. So the question about the false positives, the manufacturer of the kit tested 371 samples, which were confirmed COVID negative samples, and they report that the test accurately identified 369 of the 371 as confirmed negative. So in other words, the false positive rate is 2 out of 371, which would be 99.5% specificity, or a false positive rate of 0.5%. In the independent assessment done at the lab at Stanford, there were 2 samples. The first sample was 30, and the next sample was 88, and the test had 0 false positives in those. So it had a specificity of 100%. So in general, based on these 2 assessments, we think that the false positive rate of the test is really low. And when we do our statistical analysis, we are going to adjust our estimates of the prevalence based on the false positive rate or the specificity of the test, as well as based on the sensitivity of the test or the false negative rate of the test. The other question was, what do we make of the findings that more men were infected versus the differences across race and ethnicities? I think those findings are very preliminary. We haven't done the proper statistical analysis on them to see if they are, just chance or whether they are really statistically different from each other. So I would not want to comment on those findings right now.
Okay, the next question.
Thank you. Next, we'll go to Claudia Prosciutto with.
This question is for Barbara. For the general public, testing remains limited to people with symptoms, and I'm wondering if that's the case for nursing homes and assisted living facilities, given the high risk for residents at those facilities. Shouldn't there be widespread testing of staff and residents? And if that's not happening, why not? And are you trying to change that? Thank you.
Yeah, that's a great question, Claudia, and we agree there should be widespread testing at every nursing home where there's an outbreak. And we've actually been working with the state as well on helping us sort of enhance our capacity to do more, to more easily be able to do that testing. But yes, right now we are trying at every site where there's an outbreak to make sure that we have the capacity to test people and have those test results where there's no other lab that's been identified by the nursing home. Sometimes they already have an arrangement with a lab, but if they don't, we'll have those lab specimens taken to our lab so that we can process them quickly. But I think the question is more complicated perhaps because at these sites we may need to do much more frequent testing, particularly among staff, so that because as we know, some people can be negative and then become positive. And it's going to be important in these sites where we have very vulnerable people And as you've noticed, we can have a quick spread that we're able to quickly identify those people that are positive and move them out into isolation if they're a staff person, and if they're at the site, move them quickly into an isolation room at the facility so that we don't keep seeing this massive spread at some of the sites. But I agree with you. We need to be able to do more testing there. Next question.
Thank you. Next, we'll go to the line of Dave Lopez with CBS 2 News. Please go ahead.
Hi, Dave. Are you there?
Found in this testing, and are we any closer to the so-called herd immunity? And a quick note on what does this now do to the mortality rate based on your new numbers on your study?
The first part of your question got cut off. What was the first part of your question, Dave?
Is there anything encouraging what you found about this study, which leads into the fact, can we get closer to a herd immunity?
Got it.
Yeah. So thanks, and hi, Dave. All three questions, good questions, and they're all very much related to each other. So we actually found that about 5% of Angelinos probably have, in fact, at some point in time been infected with COVID-19. That means that there are 95% of us who have not. So you could look at that both ways. We've done a great job slowing the spread, and I want to thank everyone because this means we've been very successful. Even though that's hundreds of thousands of people, we've done this in a way that hasn't overwhelmed our healthcare system and need to continue to do that. I think if there is a part of this that's hopeful for us, it is that the mortality rate now has dropped a lot. So if you think the denominator now for the number of positive cases in LA County is 300,000 and it's not 12,000, then our mortality rate has dropped from 4.5% to more like either 0.1 or 0.2%, depending on which number you choose to use, which I think does provide us with some hope that this disease, while extraordinarily devastating and causes a lot of death, because that's still more death than you have from like influenza, and more death happening in a much shorter period of time, over a couple of months. It's not as high a rate of death as what we were looking at. That's no consolation to the families and friends of people who have died. Every number that we talk about here is someone's life. But I do know that people were very worried, particularly in the medical field, about the high rates of mortality that we were reporting. So I think as much as we are able to understand what the real denominator is, that means like how many people really were infected, and then how many people got sick and were in the hospital, and then how many people unfortunately passed away. It does help us with all of our planning about how to move forward into recovery. But thanks for your questions. We'll take the next question.
Thank you. Next, we'll go to Josh Haskell with ABC 7. Please go ahead.
Yeah, what can you tell us about your reaction to the relaxed stay-at-home order that has taken place in neighboring Ventura County? And have you been in communication with them? And you, Dr. Ferrer, mentioned the weather and how it's going to be a really nice rest of week and weekend. Is there any concern that folks from LA County would go to Ventura County because we're hearing that parks and golf courses will be open there?
Dr. Ferrer? That's a good question.
It's a great question. So, every county is different, and yes, all of the different counties in Southern California, we do talk with each other, but everybody's using different data points to make their decisions, and that's completely appropriate. I do want to really beg people who are in LA County, please do not go to Ventura to use their outdoor spaces for a couple of reasons. One is you'll overwhelm a county that is trying to sort of relax some of their restrictions for their residents and do so in a sensible way. And you could, because you'll be in closer contact with lots of other people, you could inadvertently come back infected yourself and then spread that infection to other people in our county, something we're desperately trying to avoid. So we ask people to have more patience. As you can tell by the numbers we keep reporting, we have lots of cases here, and we have lots of people dying still. And we're not at the point where we can, at this moment in time, relax our stay-at-home orders, but we are going to relax them, and we're going to relax them as soon as it is sensible for us to lift up restrictions. And like other counties that are moving in that direction, we too want to make sure that people can get outside and enjoy the beauty that LA County has to offer. But we do need to do that safely, and we do need to have some pieces in place so that we can protect each other when we do reopen. So I'm really asking people, please hang with us a little bit longer, stay home, don't go up to Ventura County. I know they'd appreciate it, and for sure we would appreciate it. We'll take the next question. Thank you.
Next, we'll go to Anna Almendrala with California Healthline. Please go ahead.
Hi, this question is for Dr. Ferrer. You mentioned that LA County is welcoming the strike teams from the state level to try to help with the nursing facilities. I just wanted to know, what exactly does LA County need from these strike teams that the county's initial infection control teams weren't able to do? And also, I was wondering if you guys were going to be able to post the initial nursing home evaluations that the county team did back in February anywhere.
I can, thanks a lot for your questions. I can ask about the last question, like some of that information might be confidential for the sites, but we can certainly post a summary of what we did so that you'll have a good sense of all of the sites that we visited. And in terms of the first question that you asked, which was, what are we, could you repeat that question again?
Yeah,
the
what are you
teams.
hoping to get from state level?
Sorry. Yeah, they're not really strike teams. They're like, I call them like help teams, but support teams. They're really support. One of the biggest issues we're having at the nursing homes is that they have a lot of staff that are out because they're infected and they're sick. And some people are out because they needed to be quarantined. So that creates an even worse situation at any one of these nursing facilities that has an outbreak because they have less staff. So one of the things we've asked from the state, and I want to thank the governor and Dr. Galley, the Secretary of HHS, for being so responsive, is we've asked for help making sure that all of our nursing homes have enough staff. So they've arranged to have other people come that can in fact be sort of like relief staff at nursing homes so that they can all stay open and continue to care for their patients. So thank you. And we'll take the next question.
Thank you. Next, we'll go to Robert Garova with KPCC. Please go ahead.
Thanks. Could you say what the company was that supplied this serology test? And what do we know about the accuracy of that particular test? And then the number you quoted for population of LA County being 8 million, is that because we're just looking at adults? Could you confirm that?
Yes, so I'll take the last question first. According to the census, the population of LA County is around 10 million, and about 8 million of them are adults. So the 8 million population is just for adults. On the company whose test we use, the company is called Premier Biotech, and it's based in Minnesota. Premier Biotech has submitted their data to the FDA. They have a letter to the FDA on their website. And that data reports the sensitivity and the specificity of the test. So based on that data, the specificity of the test was around 99.5%, as I told earlier, and the sensitivity of the test was greater than 90%. There were two separate assessments where we used a small sample of patients at a lab in Stanford and try to assess the sensitivity of the test. In those assessments, the sensitivity varied from about 72% to 93%. And when we do the analysis, again, it's important to remember that we're just doing the analysis to count the expected number of people in Los Angeles County who've been infected. So we adjust our analysis for accounting for the specificity and the sensitivity of the test. So we take into account the accuracy, and then we readjust our statistical analysis. So I think that answers that question. Thanks.
So we have time for one more question.
Thank you. Next, we'll go to Ryan Millay with the Associated Press. Please go ahead.
Yeah, thank you. Were the people also tested or screened for current signs of the virus? Is there a chance that some people were currently infected with COVID-19 but didn't show symptoms and hadn't yet developed the antibodies? And I'm also wondering if there was a questionnaire or follow-up with people who did test positive for the antibodies to find out what percentage of those people reported having had some mild symptoms or symptoms not serious enough to have gone and sought out a test.
I'm going to ask Dr. Simon to come up and answer that question with the Department of Public Health. Dr. Simon?
Hello. So, yes, we did. Let me raise this. Thank you. So, yes, we did ask about symptoms over the past 2 months, and many of our participants did report having had symptoms over the past 2 months. But, of course, we can't be sure that those symptoms were related to COVID. So there were many other infectious agents, flu and other things circulating at the time. So it's hard to conclude just from our data what percentage, for example, may have had no symptoms and had the infection. Your other question, if you could repeat for me.
Yeah, I was wondering if people were also screened or tested for the current sign of the virus. For example, is there a chance that somebody currently had COVID-19 on the dates you were testing, but they were asymptomatic or had not yet developed the antibodies that would be picked up by the serology test?
Yes, that's a great question. So for those that did test antibody positive, we did offer then the PCR test so that they could have further information. It was voluntary. And then we were very clear in the informational materials that we gave to people, both about positive test results and negative test results, that there are false positive and false negative results, and so they should take appropriate precautions. Thank you.
Thank you.
Now we are going to have remarks in Spanish. You got it? Okay. Thank you.
Buenas tardes a todos. Gracias a la supervisora Barger y a toda la Junta de Supervisores Su liderazgo durante este tiempo extraordinario ha facilitado un esfuerzo coordinado y de colaboración, y aprecio mucho todo lo que hacen. Para actualizarlo sobre nuestros números hoy, estamos tristes de informar 17 muertes adicionales. 13 de estas personas son mayores de 65 años y las 11 personas mayores de 65 años que fallecieron padecían de condiciones delicadas de salud. 2 personas tenían entre 41 a 65 años y una de estas personas padecía de condiciones delicadas de salud. Una persona tenía entre 18 a 40 años y no padecía de ninguna condición delicada de salud. No tenemos esta información para un caso, como lo informa la ciudad de Long Beach. Esto eleva el número total de muertes a 617 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para COVID-19 es de 4.5%. El 89% de las personas que murieron a causa de COVID-19 tenían condiciones delicadas de salud, lo que subraya la necesidad de que hagamos todo lo posible para que las personas con enfermedades delicadas puedan permanecer seguras en sus hogares. Para las 544 muertes en las que se ha identificado la raza, etnia 16% son afroamericanas, el 17% son asiáticas, el 36% son latinas, el 28% son blancas y el 3% se identifica con otra raza, etnia. A medida que informamos el número de personas que han muerto por COVID-19, cada día sabemos que estos números representan vidas perdidas y familias y amigos que están experimentando un profundo dolor. Lo sentimos mucho y nuestros pensamientos y oraciones están con ustedes. Durante el fin de semana recibimos una gran acumulación de resultados de pruebas de un laboratorio. Los resultados fueron de pruebas realizadas del 7 al 14 de abril. Como resultado, estamos reportando 1,491 casos hoy, aunque esto de ninguna manera representa nuevos casos en un solo día. 1,998 de estos casos son de la acumulación de resultados y los 293 adicionales son de nuestros casos reportados diariamente. Más bien, esto demuestra el aumento de los casos que hemos estado esperando, ya que el virus se ha extendido por todo el condado de Los Ángeles y la capacidad de hacer pruebas ha seguido aumentando. Hay 13,816 casos totales en el condado de Los Ángeles. Estos casos incluyen 457 casos reportados por nuestros colegas en la ciudad de Long Beach y 215 casos reportados por la ciudad de Pasadena, que tienen departamentos de salud independientes. Estamos reportando 47 casos confirmados entre personas sin hogar. La mayoría no tenía refugio. 12 de los refugiados fueron aislados adecuadamente y los contactos cercanos están en cuarentena. Estamos llevando a cabo investigaciones en 8 refugios diferentes e identificado personal e invitados que necesitan pruebas, aislamiento y cuarentena. 3,465 casos han sido en algún momento hospitalizados, el 25% de todos los casos positivos. Actualmente, 1,709 están hospitalizados. El 30% de estas personas están en la unidad de cuidados intensivos y el 17% están en ventiladores. Actualmente, estamos investigando 265 entornos institucionales con al menos un caso confirmado de COVID-19. 37 investigaciones adicionales desde el viernes. Estos incluyen hogares de ancianos, instalaciones de vivienda asistida, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 2,733, incluidos tanto el personal como los residentes. 1,580 de estos casos confirmados son residentes y 1,153 son empleados. Nos entristece informar que 241 residentes han fallecido a causa de COVID-19 en estos entornos. Esto incluye instalaciones de enfermería especializada y vivienda asistida. Estos ahora representan el 39% de todas las muertes. Esta semana esperamos tener un tablero con información por sitio que incluya el número de casos positivos y sospechosos entre los residentes y el personal y el número de muertes. Solicitamos asistencia del CDC y del Estado para abordar la necesidad de una mayor asistencia técnica en los sitios en torno al control de infecciones y necesidad de apoyo de personal para abordar de la alta tasa de casos. También estamos trabajando con proveedores de hogares de ancianos para aumentar los sitios que pueden atender a pacientes con COVID-19 que necesitan residir en instalaciones de enfermería especializada y en centros de atención intermedia. Estamos reportando 78 casos confirmados en algún momento en las instalaciones de la cárcel, 26 reclusos y 52 empleados. La oficina del alguacil informa por sus instalaciones. 19 reclusos actuales han dado positivo, 7 están recuperados, 64 están en aislamiento y 1,724 están en cuarentena. 59 casos en la prisión estatal, 47 reclusos y 12 empleados, 48 en las instalaciones penitenciarias federales, 46 reclusos y 2 empleados. Estamos informando una segunda muerte de una persona que estuvo internada en una prisión federal y 10 casos en instalaciones juveniles, todos entre el personal. Publicamos una lista de instalaciones con casos confirmados en nuestro sitio web una vez que se ha notificado a todo su personal, residentes y familiares. Y puede ver el informe actualizado de todos los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. El Departamento del Alguacil del Condado de Los Ángeles informa 51 casos positivos entre el personal, 307 empleados están en cuarentena y 543 empleados han regresado a trabajar. El Departamento de Bomberos del Condado de Los Ángeles está reportando 17 casos positivos entre el personal, 9 aislados en el hogar, 3 que están enfermos en el hogar y 14 que han regresado al trabajo. Gracias al alguacil Villanueva y al jefe de bomberos Osby por rastrear e informar estos datos. Más de 80,000 personas han sido evaluadas y se reportan resultados en el Condado de Los Ángeles. El 13% fueron positivas. Hoy compartimos con ustedes algunos hallazgos preliminares de nuestro estudio de prevalencia comunitaria. Estamos haciendo este estudio en asociación con la Universidad del Sur de California y el grupo LRW. Y quiero agradecer al Dr. Niraj Sood de la Facultad de la Escuela de Políticas Públicas Price de la Universidad del Sur de California por estar aquí. Evaluamos 863 adultos del Condado de Los Ángeles entre el 10 y el 14 de abril usando pruebas serológicas, que son las pruebas que muestran si una persona ha sido positiva para COVID-19 y ha desarrollado anticuerpos contra el virus. Esto proporciona un mejor entendimiento de la cantidad de la población que en algún momento ha sido positiva por COVID-19, independientemente de que si alguna vez se hicieron la prueba o si alguna vez tuvieron síntomas. En general, el estudio estima que la prevalencia de los anticuerpos contra COVID-19 en el Condado de Los Ángeles es de 4.1%, con un rango de 2.8% a 5.6%, cuando se tiene una cuenta al margen de error estadístico. Esto se traduce en un estimado de 221,000 a 442,000 adultos en el Condado de Los Ángeles infectados en algún momento con COVID-19. Esto sugiere que el número total de personas con infección pasada o actual es de 28 a 55 veces mayor que el número de casos reportados de COVID-19 en el momento del estudio. Esto refuerza la importancia de quedarse en casa y del distanciamiento físico. Hay muchas personas que han sido positivas por COVID-19, algunas que no han tenido síntomas. Aunque el tamaño de la muestra es relativamente pequeña, podemos compartir algunas estimaciones iniciales sobre quién tenía más probabilidad de haber sido infectado. La prevalencia estimada fue de 6.6% entre hombres y 1.8% entre mujeres. Se estima que el 7.1% de los afroamericanos, el 6% de los blancos, el 4.2% de los asiáticos y el 2.5% de los latinos han sido en algún momento positivos para COVID-19. La prevalencia estimada fue de 2.4% entre los 18 y 34 años, 5.6% entre los 35 y 54 años y 4.3% entre los 55 y mayores. Nuevamente, estos datos son preliminares. Todavía estamos realizando análisis para comprender mejor la prevalencia de COVID-19 entre los grupos dentro del Condado de Los Ángeles. Como mencionamos la semana pasada, también esperamos expandir la recopilación de datos en comunidades vulnerables y realizar estudios específicos en grupos de alto riesgo, como profesionales de la salud, personal de primeros auxilios, personal y residentes en centros de enfermería especializada y aquellos que viven o trabajan en otras instalaciones congregadas. Esta información nos ayuda a comprender cómo se está mostrando COVID-19 en nuestras comunidades. Y como recordatorio, para aquellos de ustedes que están experimentando violencia o la amenaza de violencia en su hogar, hay ayuda disponible. Si es amigo o familiar de alguien que se siente inseguro en su hogar, también puede comunicarse con estos servicios. Los servicios de violencia doméstica del Condado de Los Ángeles siguen disponibles y los refugios están abiertos y aceptan entradas. La policía está respondiendo a las llamadas de violencia doméstica al 911. Se emiten órdenes de protección de emergencia y hay servicios legales sin fines de lucro disponibles. Puede llamar a la línea directa de la violencia doméstica al 1-800-978-3600. Y hay recursos en el sitio web del Consejo de Violencia Doméstica en publichealth.lacounty.gov/DV Council, de B chiquita COUNCIL. Al finalizar, quiero mencionar que muchos de ustedes han hecho todo lo posible para no abrumar nuestro sistema de atención médica aquí en el Condado de Los Ángeles. Pero si tiene dolor en el pecho u otros síntomas que pueden indicar que necesita ir a la sala de emergencias, vaya. Hay capacidad en las salas de emergencia. Además, a medida que el clima mejora y tenemos días más hermosos en el sur de California, quiero recordarles a todos que la orden más seguros en casa permanece en efecto. Se prohíben las reuniones públicas de cualquier tipo, incluso al aire libre. Pero aún podemos disfrutar del aire libre. Podemos ir a caminar o correr o estar sentados en nuestros patios, siempre que lo hagamos solos o solo con miembros de nuestro hogar. Aprecio todo lo que está haciendo para frenar la propagación de COVID-19. Los esfuerzos que hemos realizado como comunidad están funcionando. Gracias. Okay, there's no more questions. We're moving over to remarks in Armenian.
Բարի օր բոլորին։ Շնորհակալ եմ վերահսկիչ Barger եւ վերահսկիչ մարմինների ողջ խորհրդին։ Դուք շարունակում եք ուժեղ աջակցություն ցուցաբերել ներկա իրավիճակի վերաբերյալ։ Տեղեկությունները հետևյալն են։ Այսօր ցավով ենք հայտնում եւս 17 մահվան մասին։ Այս մարդկանցից 13-ը 65 տարեկանից բարձր են, որոնցից 11-ը ունեցել են ուղեկցող առողջական խնդիրներ։ Երկու անձի տարիքը 41-ից 65-ն է եւ բոլորը նույնպես ունեցել են ուղեկցող առողջական խնդիրներ։ Մեկ անձ 18-ից 40 տարեկան է եւ ուներ ուղեկցական առողջական խնդիրներ։ Սա բերում է ընդհանուր մահերի թիվը 617-ի։ Լոս Անջելես շրջանում եւ մահերի տոկոսը COVID-19-ից կազմում է 4.5։ COVID-19-ով մահացած անձանց 89%-ը ուներ ուղեկցող առողջական խնդիրներ, ընդգծելով, որ մենք պետք է անենք հնարավոր ամեն ինչ, որպեսզի հնարավոր լինի նրանց, ովքեր ուղեկցող առողջական խնդիրներ ունեն, իրենց տանը ապահով մնան։ 544 մահվան դեպքերի ռասա էթնիկ պատկանելիությունը հետևյալն է. 16-ը աֆրոամերիկացի են, 17-ը ասիական, 36-ը լատինեքս, 28-ը սպիտակ, 3-ը ճանաչվել են որպես մեկ այլ ռասա ազգություն։ Հանգստյան օրերի ընթացքում մենք ստացանք թեստի արդյունքների մեծ քանակություն մեր լաբորատորիաներից։ Արդյունքները ապրիլի 7-ից 14 անցկացված թեստերից էին։ COVID-19-ով մահացած մարդկանց ընտանիքների եւ ընկերների վիշտը ճնշող է։ Մենք սգում ենք ձեզ հետ եւ մեր մտքերն ու աղոթքները ձեզ հետ են։ Այսօր մենք հայտնում ենք նաեւ 1491 դեպքերի մասին։ Ընդհանուր առմամբ 11816 դեպք է գրանցվել Լոս Անջելոս շրջանում։ Այս դեպքերը ներառում են 457 դեպք, որոնք հաղորդվել են մեր գործընկերների Long Beach քաղաքում 215 դեպք եւ Փասեդենայում 457 դեպք։ Մենք հայտնում ենք 47 հաստատված դեպք անօթևան մարդկանց շրջանում։ Մեծամասնությունը անապաստան են։ 12-ը, որոնք ապաստան են ստացել, պատշաճ, մեկուսացված եւ սեղմ կապերը կարանտինացված են։ Հոսպիտալացման տվյալները 3465 դեպք ինչ որ պահի հոսպիտալացվել են, որը կազմում է բոլոր դրական դեպքերի 25%-ը։ Ներկայումս հոսպիտալացվել է 1709 մարդ, որոնցից 30%-ը գտնվում է ինտենսիվ խնամքի բաժանմունքում, իսկ 20%-ը միացված են շնչառական օդափոխիչների։ Ինստիտուցիոնալ բնակության հաստատություններ։ Ներկայումս քննություններ են կատարվում 265 ինստիտուցիոնալ բնակության հաստատություններում։ Դրանց թվում են ծերանոցներ, ապաստաններ, բուժման կենտրոններ, օժանդակվող բնակելի հաստատություններ եւ քրեա կատարողական հիմնարկներ։ Ինստիտուցիոնալ միջավայրում հաստատված ընդհանուր դեպքերը 2733-ն են, ներառյալ անձնակազմը եւ բնակիչները։ Այս դեպքերից 1580-ը բնակիչներ են, 1153-ը անձնակազմ։ Ցավով ենք հայտնում, որ այս հաստատություններում COVID-19-ով մահացել են 241 բնակիչ, որոնք կազմում են բոլոր մահերի 39%-ը։ Հաջորդ շաբաթ մենք հուսով ենք, որ կունենանք գրացուցակ կայքի միջոցով, որը ներառում է բնակիչների եւ աշխատողների շրջանում դրական եւ կասկածելի դեպքերի քանակը եւ մահերի թիվը։ Մենք խնդրել ենք աջակցել պետությունից լուծելու վարակի վերահսկման շուրջ տեղակայացված տեխնիկական օգնություն, անհրաժեշտություն եւ անձնակազմի աջակցություն դեպքերի բարձր տեմպերը լուծելու համար։ Մենք զեկուցում ենք, որ հաստատված 78 դեպքերը արձանագրվել են քրեա կատարողական հիմնարկներ, 26 դատապարտյալ եւ 52 աշխատող։ Շերիֆի գրասենյակը զեկուցում է, որ իրենց հաստատություններում ներկայումս 19 բանտարկյալներ տեստավորվել են դրական, 7-ը առողջացել են, 64-ը մեկուսացված են, 11724-ը կարանտինում են։ 59 դեպք նահանգային բանտերում, 47 բանտարկյալ եւ 12 աշխատակազմ եւ 4 աշխատակազմի դեպք անչափահասների հաստատություններում։ Մենք տեղադրում ենք հաստատված դեպքերի ցուցակը մեր կայքում աշխատողների, բնակիչների եւ ընտանիքներին տեղեկացնելուց հետո։ Եվ Լոս Անջելոս շրջանի արձանագրված բոլոր նոր դեպքերի զեկույցը կարող եք տեսնել առողջապահության վարչության կայքում publichealth.lacounty.gov։ Շերիֆի եւ հրշեջ վարչությունների աշխատակիցների տվյալները։ Լոս Անջելոսի շրջանի շերիֆի վարչությունը զեկուցում է 51 դրական դեպք անձնակազմի մեջ, 307 կարանտինի մեջ են, 4543 վերադարձել են աշխատանքի։ Լոս Անջելոսի շրջանի հրշեջ վարչությունը հայտնում է 17 դրական դեպք անձնակազմի մեջ, 9 մեկուսացված են տանը, 3-ը հիվանդ են տանը, 14-ը վերադարձել են աշխատանքի։ Շնորհակալություն շերիֆ Վիլոնային, պետ Օզբին այս տվյալները հետևելու եւ զեկուցելու համար։ Թեստավորում։ Ավելի քան 80,000 մարդ թեստավորվել են եւ արդյունքներից զեկուցել են Լոս Անջելոս շրջան, որից 13%-ը դրական են։ Սերոլոգիայի ուսումնասիրություն։ Այսօր մենք ձեզ հետ ենք կիսում մեր համայնքի տարածվածության ուսումնասիրության նախնական որոշումները։ Մենք այս ուսումնասիրությունը իրականացնում ենք Հարավային Կալիֆոռնիայի համալսարանի եւ LRW խմբի հետ համատեղ։ Եվ ես ուզում եմ շնորհակալություն հայտնել Հարավային Կալիֆոռնիա համալսարանին, հասարակական քաղաքացիության գների դպրոցի բժիշկ Ներաջ Սուդին այսօր այստեղ գտնվելու համար։ Մենք ակնկալում ենք ավելին լսել ու ուսումնասիրել։ Ապրիլի 10-ից մինչև 14-ը մենք փորձարկել ենք 863 մեծահասակների շրջանում դեպքեր։ Օգտագործվող սերոլոգիական փորձարկումը, այսինքն այն թեստավորումը, որը ցույց է տալիս, որ անձը երբևէ դրական է եղել COVID-19-ի համար եւ զարգացրել է հակամարմիններ վիրուսի դեմ։ Սա հնարավորություն է տալիս ավելի լավ հասկանալ, թե բնակչության ոմանք ինչ-որ պահի դրական են ունեցել COVID-19-ի համար, անկախ նրանից, որ դրանք երբևէ փորձարկվել են կամ երբևէ ախտանիշեր են ունեցել։ Ընդհանուր առմամբ ուսումնասիրությունը գնահատում է COVID-19-ի հակամարմինների գերակշռությունը Լոս Կոմիսկ նահանգում 4.1% սխալի վիճակագրական լուսացքում։ Սա թարգմանում է մոտավորապես 221,000-ից 442,000 մեծահասակներ Լուաս նահանգում, ինչ-որ պահի վարակված են COVID-19-ով։ Սա հուշում է, որ անցյալի կամ ընթացիկ վարքավարության ունեցող անձանց ընդհանուր թիվը 28-ից 55 անգամ ավել է, քան ուսումնասիրության պահին COVID-19-ի հաղորդված դեպքերի քանակը։ Ուժեղացնում է տանը մնալու և ֆիզիկական հեռավորության կարևորություն տալը։ Կան շատ մարդիկ, ովքեր դրական են վերաբերվել COVID-19-ին, ոմանք ովքեր աշխատանիշ չեն ունեցել։ Չնայած նմուշի չափը համեմատաբար փոքր է, մենք կարող ենք մի քանի վաղ գնահատականներ հաղորդել այս մասին, թե ով է հավանական վարակվել։ Տղամարդիկ ավելի հավանական էին, քան վարակված էին կանայք։ Տղամարդկանց մոտ 6.6%-ն էր, իսկ կանանց մոտ 1.8%-ը։ Աֆրոամերիկացիների 7.1%-ը, սպիտակամորթերի 6%-ը, ասիացիների 4.2%-ը, լատինեքս 2.5%-ը, 18-ից 34 տարեկանները 2.4%-ը, 35-ից 54 տարեկաններ 5.6%-ը, 55-ից բարձր տարիքի 4.3%-ը։ Նորից, այս տվյալները նախնական են։ Մենք կշարունակենք նահանգի բնակիչների նմուշարել մոտակա մի քանի ամիսների ընթացքում ավելի լավ հասկանալու համար խմբերի մեջ COVID-19-ի տարածվածությունը։ Ինչպես ես նշեցի անցած շաբաթ, մենք նաև հույս ունենք ընդլայնել տվյալների հավաքագրումը խոցելի համակարգներում և իրականացնել թիրախային ուսումնասիրություններ բարձր ռիսկային խմբերի, ինչպես են առողջապահական աշխատողները, առաջին պատասխանատուները, բուժքույրերը հաստատություններում, աշխատողներն ու բնակիչները, ինչպես նաև նրանք, ովքեր ապրում են, աշխատում են այլ պայմաններում։ Այս տեղեկությունները օգնում են մեզ հասկանալ, թե ինչպես է COVID-19 ցուցադրվում մեր համայնքներում։ Որպես հիշեցում, COVID-19-ի հակամարմինների նկատմամբ դրական լինելը չի նշանակում, որ անձը անձեռնամխելի է կամ ի վիճակի չի նորից վարակվել։ Անհրաժեշտ է ավելի շատ հետազոտություններ հասկանալու համար, թե ինչպես պաշտպանության ունեն մարդիկ, ովքեր արդեն վարակվել են COVID-19-ով։ Ընտանեկան բռնություն։ Ընտանեկան բռնության օգնությունը մատչելի է շերիֆ Դեթին խնդրանքով ներառյալ, նա այս մասին այսօր խոսել է իր ճեպազրույցում։ Որպես հիշեցում ձեզանից այն մարդկանց համար, ովքեր բռնության են զգում կամ ձեր տանը բռնության սպառնալիք եք զգում, օգնություն է տրամադրվում։ Լոս Անջելես շրջանի ընտանեկան բռնության ծառայությունները մատչելի են և կացարանները բաց են։ Իրավապահները արձագանքում են ընտանեկան բռնության 911 կանչերին։ Կարող եք զանգահարել ընտանեկան բռնության թեժգից 1-800-978-3600 և ընտանեկան բռնության խորհրդի կայքում կան ռեսուրսներ հանրային առողջության lacounty.gov/dvc-claim։ Ուզում եմ նշել, որ ձեզանից շատերը արել են հնարավոր ամեն ինչ, որպեսզի չփլուզվի մեր առողջապահական համակարգը այստեղ։ Բայց եթե կրծքավանդակի ցավ ունեք կամ այլ ախտանիշներ, որոնք կարող են լինել նշան, որ դուք պետք է գնաք շտապ օգնություն, խնդրում ենք, գնացեք։ Հնարավորություն կա արտակարգ իրավիճակներում։ Նաև, երբ եղանակը բարելավում է եւ մենք ունենք ավելի գեղեցիկ հարավային Կալիֆոռնիայի օրեր, ես ուզում եմ բոլորին հիշեցնել, որ ավելի անվտանգ է տանը։ Կարգը մնում է տեղում։ Արգելվում է ցանկացած տեսակի հասարակական հավաքույթներ, ներառյալ դրսում, բայց մենք դեռ կարող ենք վայելել դրսում զբոսանքներ կամ վազքեր, կամ մեր բակերում նստած, քանի դեռ դա անում ենք միայնակ կամ մեր տանը, անդամների հետ միասին։ Ես բարձր եմ գնահատում այն ամենը, ինչ անում ենք COVID-19-ի տարածումը դանդաղեցնելու համար։ Այս ջանքերը, որ մենք կատարել ենք որպես համայնք, աշխատում են։ Շնորհակալություն։ This concludes our press conference.